welcome to the show where we share the stories of the many who intersect with our healthcare system but are rarely heard from. My name is Kevin Poe, founder and editor of Kevin MD. Today in the show, we have Andy Schoonover. He is a healthcare executive, and he wrote the Kevin MD article, Open Enrollment, It's Time to Leave Your Insurance Plan Behind. Andy, welcome to the show.
Thanks for having me. Glad to be here.
We'll get into your article in a little bit, but first off, can you share your story and journey to where you are today?
Yeah, I was in healthcare before my existing company. I was running a remote patient monitoring company. So we were monitoring blood sugars and blood pressure and things like that out of the home of folks with chronic conditions and selling that into the big Medicare Advantage plans to keep those folks out of the hospital. I sold that company to a private equity firm in 2014. And as such, I lost my health insurance from my company, like most Americans getting health insurance directly from our companies. And so I went over to healthcare.gov and got a plan that was $1,200 a month for me, my wife, and my two girls. And it worked until we actually had to use it. So my little one was having recurring ear infections. So we went to the ear, nose, and throat doc, and he said she needed to get tubes in her ear. So headed over to the local hospital, 15-minute procedure, got the bills, $8,000. I was like, wow, like this is my first situation in which I actually had engaged with the healthcare system at, the egregious prices. And not only that, but my health plan came back to me and said it was medically unnecessary, even though she had a perforated eardrum and wouldn't pay for it. And it was that point where I was like, somebody's got to do something about health insurance. It's too many people are being financially impacted by a really broken system. And so that's kind of where I'm at today is thinking about this a little bit differently.
All right. So tell me some of the ideas that you have to solve this problem.
Yeah. So over the last couple of years, since I said goodbye to my health insurance plan because they rejected my claim, I've been uninsured. And, a lot of people, that sounds super risky, but me and my wife and my two girls have been uninsured for 2 years. And we've been building some tools to allow people to operate outside of the kind of legacy health insurance system. And so as you kind of look through all of the needs, the ones where the day-to-day maintenance is pretty easy nowadays, especially given all the telehealth options we have out there. We can get that for a few bucks. And then you think about the bigger ones, the bigger expenses. We've pulled some interesting ways of doing this from crowdfunding sources like GoFundMe. I was on GoFundMe, 6 or 8 months back, and I was like, wow, these people are getting all of their big bills paid for by strangers. And so can we do that in a little bit more formalized of a way? And so we've basically put some tools, off the shelf telehealth type of tools with some crowdfunding tools on the back end to let people pay for both the small expenses and the big expenses. And we've saved about $10,000 a year, my family has, versus going to your healthcare.gov type of plan.
So you talk more about that in your Kevin MD article. It's titled Open Enrollment, It's Time to Leave Your Health Insurance Plan Behind. Now, for those who didn't get a chance to read your article, can you just walk my audience through it and share the story of why you decided to write it?
I think people don't understand that there are alternatives out there than healthcare.gov or some of these short-term plans, which are total garbage from my perspective. And so in the article, I try to outline why and how you can actually operate outside of the insurance system. And so that's kind of the bulk of that article, just saying, hey, there are alternatives for people who don't want to deal with health insurance. Look, 250,000 people every year who have health insurance go bankrupt because of medical bills. That is telling me that health insurance is not working. The whole point of insurance is if you have a large event that it doesn't put you into financial distress. And the fact that we have 250,000 people that have health insurance go bankrupt because of a medical event is challenging to me. I've kind of laid out my story, which $8,000, I've been, super fortunate, but the vast majority of Americans can't pay $8,000 for a health event that is, pretty benign. I mean, that could happen to anybody. And so that's really kind of laid out the case in your article to say, hey, there are options here, there are alternatives. And so people really should take a look at them before, signing up for a healthcare.gov plan. And I think even for your employer-based insurance, you look at some of the alternatives before you sign up for those things.
So one of the tools that you mentioned was crowdfunding and GoFundMe. Tell me a story of how that would work. So tell me a story of how a GoFundMe would help pay for a big medical or unexpected medical bill.
Yeah, I'll take one of the really biggies. We had a woman who had a brain hemorrhage, I don't know, 6 or 8 weeks ago, was in the neuro ICU for, I think, a week and a half. The bill was about 250 grand. And so what do we do with that? Right. We help her negotiate that bill down with the hospital. And so we're going to get that bill down to probably about $80,000 from the 250. And then we've got and by the way, that the hospital also will stretch that payment out over a couple of years. So just to make the math easy, let's just say it's $4,000 a month for 20 months. So if you have a small group, a couple thousand people, that's just a few bucks a month per person to pay for a pretty catastrophic type of situation. And so what we will do is we'll go out to our 2,000 members, and I said, hey, I've got this woman. She had a brain hemorrhage. Bill is $80,000. We need to crowdfund, $4,000 a month for the next 20 months. Are you in? And they will say yes or no. And so why would they say yes for somebody that they don't know? What we do is we have a generosity score. And so if you say yes to these, then you are considered within the community to be someone who's super generous. If you say no to a lot of these, then you become a reputation of being super stingy. And so why is that important? Well, when you have a big healthcare bill, you want the community to look at you and say, oh, this person is super generous. And so I'm going to fund that person. And so far to date, anybody who's had a 95 generosity score, which basically says they say yes 95% of the time, has gotten 100% of their bill funded. So it seems to be working. So it's this rule of reciprocity that we're using to pay for some of these bills that is working really, really well. So totally different way than doing it in the insurance, but it does bring community back to healthcare, which is how we've been doing this for thousands of years. Somebody in the community gets hurt, needs help. The community rallies around them to help them out. The insurance plans have gotten in the middle of that generosity. And so we're trying to take the insurance plan out of that transaction. So it's working pretty well.
So within your community, how successful is it that people can get most of their large unexpected medical bills crowdfunded?
Yeah. So, in 100% of the people who have a 95 or greater generosity score, which basically means if you give, and we limit the amount that we ask you to give every month to how much you put in. So for somebody between the ages of 6 and 54, it's $175. So we're not typically going to ask you for more than $175 a month to give to somebody. And so, if you give, you will get, is generally, how this has worked thus far. And I think it's important too for your listeners, given that I'm assuming many of them are physicians. Physicians are loving this because what we're doing is we're taking a health insurance plan out of the payment and we're paying them on the day typically of the procedure. So another specific example is we had somebody who needed a knee replacement, at the local hospital. Is $40,000. We had an orthopedic surgeon that was going to do it for $22,000 all in for a knee replacement. And we paid them. They got paid on the day of the surgery, as opposed to waiting 60 or 90 days from a health insurance plan and haggling with them and getting, pre-certification, pre-authorizations and things like that. And so, as doctors are trying to transition into more of a cash pay model, we are a way of doing that. And so we've gotten great feedback from not only our members, but the physicians in which our members are going to as well.
Are most of your members primarily without health insurance?
Well, almost 100% of our people don't have health insurance. So they are fully uninsured. I might be the only one in America saying it's better to be uninsured than to be insured because of the insurance plan getting in the middle of all of this. And so, but 50% of our members come from being uninsured. So we're actually giving people who are historically uninsured an opportunity to a platform to get their bills, helped out. So we think that's kind of a broad healthcare wide benefit, is getting some of these people with the ability to pay these bills.
Have you received any pushback regarding your model from any entity?
Yeah, I think that the insurance plans have more money than almost anybody. Two of them are in the top 10 largest corporations on the planet, so they got a lot of money. If we make some progress here, we know that we're going to get some feedback, I'm sure. I think that the other thing that we're kind of working through is regulatory agencies. They're going to look at this and they're going to say, okay, is this insurance or is this not insurance? Are you in the business of insurance? And so we've been very careful to make sure that our customers know that this is not insurance. Your bills are not guaranteed to be paid for. I mean, here are results. You can take a look at them, but we do not indemnify. We do not guarantee. And so we're very, very careful about saying we are not health insurance, and everybody who knows joins on with us, understands that. So those are the two kind of groups of entities that I know that we will have more engagement with as we become, even more successful.
We're talking to Andy Schoonover. He's a healthcare executive, and he wrote the Kevin MD article, Open Enrollment, It's Time to Leave Your Health Insurance Plan Behind. Andy, you mentioned other tools that can work outside of the health insurance system. Of course, we talked about crowdfunding. What are some of the other tools that's available?
Yeah, one of the things that we just take a pretty proactive approach on is negotiating. People think that the health plan negotiates on their behalf, but oftentimes they don't, because there's actually an incentive given the Affordable Care Act for health plans that have the premiums go up, not go down. Given there's medical loss ratios, which I'm sure most of your listeners understand, is you can only make so much money at $1,000 premium. You can make more money at a $1,100, $1,200, $1,300 a month premium. And so they actually have an incentive for premiums to go up. So we actually negotiate on behalf of our members for, pretty much all of the services that they get. And that may just be like, hey, what is your cash pay? And given that you don't have to build the insurance plan, that cash pay price is ranging in the 20 to 40% range, just because they take a credit card over having to bill it through health insurance, any day. So we take a very kind of aggressive approach to negotiating these healthcare bills. So that's one of the big ones. We have a telehealth. So all of our members get unlimited telehealth visits. So we ask that you use telehealth before, doing anything else, just to get a first opinion from a doc. And so pretty good utilization of telehealth is a big one for us. And so those are the biggies that incorporate the vast majority of what we do. Telehealth, negotiating these bills, and then doing crowdfunding on the back end is helpful as well. If people won't negotiate, we actually have some attorneys that will help us with helping these patients negotiate with these hospitals, because there's actually an open price law in the Universal Code of Commercial Federal Law that requires hospitals to negotiate with patients who don't have a pre-existing contract. So we basically lease our attorneys to our members also, that they can use to help them with some of these more difficult negotiations. It's worked pretty well so far.
Is there a larger social commentary here that we have a community who you say is better off without health insurance and has to rely on crowdfunding? What does that say about our healthcare system?
Yeah, I mean, it's absolutely busted in so many different ways. I mean, if you have the buyer of healthcare, which is our health plans, and the seller of healthcare, which are these big hospital systems, both wanting the price of healthcare to go up, healthcare is going to go up. I mean, it's like, healthcare is so complex. It's not that complex. You have the buyer and the seller both wanting the price to go up. The price is going to go up. And so, I know that's a simplistic way of looking at that, but in essence, that's what's happening, especially on the commercial side of healthcare, which oftentimes is paying for the non-commercial side of healthcare, so that the docs in these hospital systems can pay the bill. So the fact that we don't have anybody really negotiating on our behalf yet, we as the consumers are paying the bill. We're not actually consumers, but we're still paying the bill. It's coming out of our pockets, is a really big challenge. And this is one of those few services that we buy in this country where we have no idea what the cost is that we're buying. I recently bought a new car. I know all the Ford dealerships in town. I know what the price of the car is. I can, take a look at the Chevy dealerships and see what the price of their car is. This is one of those few where I have no idea how much it's costing me to go into the hospital, or even an OBGYN appointment or a pediatric visit. We need to understand that stuff a bit more to be better consumers of healthcare. And the way that we have structured this allows us to make one step in that direction. So yeah, I mean, I think that consumers need to be more engaged in how much healthcare costs. And this is a great way of doing it through crowdfunding.
And my final question, what are some of your take-home messages that you want to leave with the Kevin MD audience?
Yeah, for the physicians out there, who are looking to escape some of the health insurance plan billing and the craziness around that. I saw a recent stat that 30% of the doc's time is spent with health insurance plans administratively. Give folks like us a chance. And, if you want to reach out to us and are interested in giving folks cash pay rates, then we would love to offer them the opportunity to do that. So we're looking for really awesome docs throughout the country to help us with this cash pay network that we're building.
And how can people reach you?
Yeah, you can reach us at joincrowdhealth.com, or I'm on Twitter and Facebook and Instagram. Andy Schoonover is my handle on all of those, or Join Crowd Health is my company's handle.
Andy, thank you so much for sharing your time and insight. And thanks again for being on the show.
Thanks so much, sir.